A recent study shows that a small majority of women believe an OBGYN visit are essential and that women are more likely to have a regular hairstylist, eye doctor, or dentist than an OBGYN. And I'll talk more about what women could face by not getting an annual exam is Dr. Carlos Herrera, who is the only gynecologic oncologist in the Valley. We all know a gynecologist, but tell us a little bit of your specialty here in the Valley.
Sure. Yeah, what gynecological oncologists do, we just specialize in just women affected with cancer. We are OBGYNs by training, but then we subspecialize just on women's cancers. And it's very important because they are fairly prevalent and they can cause a lot of problems.
And yeah, let's talk about the importance of women, the annual visit to the OBGYN. What's so important?
Sure. I cannot overemphasize how important it is to have that annual visit. It used to be a woman would go to her doctor just when she had problems or just to have a pap smear. And even the development of the pap smear initially was made to detect pre-malignant lesions. But now we can tell so much about the pap smear. Like, for example, if a woman is affected with HPV, which is a virus which is necessary but not enough to cause cancer, as well as the bimanual exam, you can tell a lot by the doctor to pay attention to how the cervix, the uterus, and the ovaries feel during that examination. And of course, the breast examination now with their adjunct studies like the digital mammography or ultrasound, which can tell us a lot of any kind of breast masses.
Let's go back to your specialty. Are women talking to their doctors about ovarian or cervical cancer? Like, what are some ways to start the conversation? Because I know just saying cancer itself is scary for a lot of people.
Yeah, it really is. And I think a lot of times out of sight, out of mind, right. or vice versa. So it's very important that a woman brings into the attention of the doctor, look, any kind of symptoms she might have, like abnormal, irregular bleeding or vaginal discharge that doesn't go away, or any kind of pain that doesn't go away. I think if you have any symptoms that are concerning to you, you should always approach them to your doctor. Because believe it or not, especially ovarian cancer is not a cancer that shows a lot of symptoms that are very obvious.
Right.
Very much a lot of times they're like mild gastritis or your clothes don't fit anymore, you think you're gaining weight, and in fact is the abdomen increasing from the development of an ovarian cancer. Now, thank God, ovarian cancer, the general population is rare. It's about 1 in 70 women have a risk of developing ovarian cancer.
And let's talk more about, the women who are affected by ovarian cancer and also the treatment that's out there.
Sure, yeah. Well, about 10% of ovarian cancer is genetically derived. And that has brought a lot of attention because there are syndromes that we know up to now that are associated with ovarian cancer, like breast ovarian cancer, just ovarian cancer that follows in families, or the other one, what we call the non-polyposis colorectal cancer. There's people who have colon cancer, but also they have breast and ovarian cancer as well. Now, we can test for those tests, and it's an easy test now. You can have just a buccal swab, and we can test for all those things. The other thing is most ovarian cancer are sporadic, so that means that they come from nowhere, and that's why a woman should be always attentive to the symptoms.
All right, thank you so much, Dr. Herrera,
sure.
for shedding light on something that is very important for women, and a lot of women, it's kind of hard to bring up.
So oh yes,
thank you for making it an easier topic.
Yes, ma'am.